Hey guys, Don here. Welcome to the $1 Million Minute. I'm going to go over kind of the things that help get to $1 million mark and beyond. And actually, today I'm going to go over the things that could break our practice. So let me tell you kind of the drama. I was going to get together our weekly newsletter that I put together. So I kind of put it together on Notion, and part of that is putting a couple of online reviews. And so I went to look at our online reviews, and I looked that in the month of December we had like 2. And then in the month of January, we had 1. And I'm like, oh boy, what happened here? Then I went to the Google My Business, like the Google business page. And so we have 4 doctors. So we have 8 listings. So 1 for each doctor in each location. And then plus another 2. So 8 plus 2. So we have 10 listings total. 8 of those listings were down. They're like suspended. And I was like, oh boy. What's going on here? Thankfully, I had a friend named Jim. Jim does podiatry growth, and he's helped me a little bit. And he's just a very smart guy, and kind of talked me off the ledge. And so what you have to do is you have to appeal. And I'm not sure why we got dinged. I don't know if someone maliciously did something. I don't know if they dinged because of a duplicate. I did notice there's one duplicate Central Mass Podiatry listing. So there's 2 of them in our Worcester office, or it could be phone numbers, because we did a couple of changes recently. So we switched the website from Patient Pop to Kajabi, and then we started the swell thing and things like that. So I'm still kind of figuring it out. I had to appeal, meaning I sent our information over to them again to reevaluate, and I'll let you know once the suspension gets up. But because of this, I feel like it's been a little bit slower in the office. And it might even be from the Google portion. Anyway, so that's the drama. I'll let you know how it turns out. On a good point, I had some extra time, and so I recorded an audit for one of the people that filled it out. One of these a young doctor that's been out of like about a year and a half. And if you go, I think the previous podcast will be about that. If you want to kind of see kind of some recommendations for him. Okay, so let's get into the day. There were 13 patients, and I had 3 open hours. Oh my goodness, a lot of open time here, and I was kind of distracted. So let's talk about what happened. This was a patient that came in, so onycholysis, and they had a porokeratoma, and so I offered them to excise it with the 2mm punch, but they opted just for the lesion excision again. No follow-up for that. Another patient that came in had an injury. He's a skater, and as he was taking his skate off, he almost took his big toenail off. So I avulsed the nail. I also did a nail sample, and I'm going to see him back to put him on oral medication. Another patient. This was a patient that had this would be a Lamisil number 2 visit, so the booster. So I gave him another prescription, and he'll follow up as needed. So no follow up for him. Another patient, 87-year-old man. He had an ulcer kind of on the lateral aspect of the hallux and the medial aspect of the second toe kind of hitting against each other, and they caused an ulceration. And I treated that. I gave some recommendation. Big bunion, and that's why it was kind of rubbing together. Gave him some shoe recommendations and things like that. I'm going to see him back in about 6 months. I think the ulcer is going to heal pretty quick. Another patient that came in for a diabetic foot exam. He had some nails that needed done, and then he also had a wart, and so I did Cantharidin on this gentleman. It's kind of interesting wart. It was kind of odd that he had a wart on his foot, but we did that, and I'm going to see him back in a month for a wart follow-up. Another patient came in. He had a concern for a laceration on the back of his Achilles region. It was pretty superficial, so I'm going to just call it a superficial laceration. And he also had some fissures in the heel. So my conversation for patients with fissures is I have them get a 42% urea, and then there's something called sleep in heel, which is like these heel socks. So those are about, I think it was about $50 or $60 for those 2, but it works really well for dry cracked heels in the wintertime. Another patient came in, kind of older female, for her bunion, got an x-ray, really just spent time on shoe recommendations for her. So I usually recommend Lems that we sell in the office, and then Ultras and Topos, which are the kind of the anatomic shoes that I like. Another patient that came in, this was a patient that had another toenail avulsion that he needed because he injured his big toenail. Had a kind of little infection at the base from an injury. Another patient that came in for partial nail avulsion, and we'll follow up as needed. She came in actually because one of my partners here sent her over for a possible Onifix, but really, when there was pain in the edge, I don't think the Onifix is going to work for her, so I just did the nail avulsion on the edges. So once again, nail avulsion if there's no signs of infection, and then I call it an incision and drainage, or if there's like signs of infection. So this was just a partial nail avulsion on the edges. Another patient came in for plantar fasciitis number 1 visit for me. So she got the handout, she got my patient education stuff, she got foam rolling, morning stretch, and night splint, meloxicam. And she'll come back in 3 weeks to see how she's doing, and then most likely see her for an ultrasound at that time. Another patient came in. This was a 61-year-old for ingrown toenail. Did an IND for this one. Another patient that came in. This was a young female in high school. She was playing hockey, but like not street hockey, but field hockey. And she got stepped on with her foot in the plantar flex position. She had a broken second metatarsal, but I was concerned some gapping, like a Liz Frank dislocation, so we got an MRI for her. Another gentleman came in for a 5th met fracture that he had been dealing with for months and months. He had an avulsion fracture, but he just never had it treated. It's actually been about 5 months now. I never was put in a boot, so I put in a boot, and I just told him he might need either it excised or shockwave therapy. And then the other one was an 8-year-old female little girl that came in for wart, and I treated it with cantharidin, and I gave her Aldera. And then the final patient, this was a patient that she's kind of has a really kind of difficult nerve issue on her second met head, kind of be a second met head metatarsalgia, along with maybe like a neuroma to the second intermetatarsal space. And so for her, I was very, very low was I able to get up on the shockwave. I wasn't able to do it that high. I've never really done it this low before, but there's really nothing else to offer this. Everything is really, really sensitive. She's been wearing these big pads in the front of both of her feet for a long, long time. So that was kind of a challenge for this one. So this is EPAT number 2. I told her to kind of give it time to see if this responds for her. So this was the day. A lot of openings, so it's kind of frustrating, but I'm glad I found. Hopefully the reason is the online. It could be it's like January and February in New England. Sometimes it's a little bit slower during this time, but it gives me time to do other things. So if you guys want to do one of these audit things, if you want to kind of see just kind of an objective way of maybe getting better in your practice, go to podiatrypracticemastery.com/audit. It's on that. You can get on my website. Just if you put that audit in, then you'll get information. It'll be a link to a Google form. Fill that out. Once I get it, I will send it back to you. So it kind of asks about like what you do for DME, what your hours are like, how many patients you see, things like that. And then I'll do a little audio recording. Once again, as you can hear it, if you go to Craig's, I'm not going to expose your name or your practice. I'm just going to kind of do it as a learning experience. I think it's good for everyone to learn together. Okay, thanks.